Welcome to Rotary. I want to start out by letting you know that Kathy Downs, Rich's wife, lost her dad on Wednesday. He was 93 years old and had been in hospice care for some time. So Rich is down there and hopes to be back next week. Any other concerns to pass on for Paul?
Do we have other requests? And let us pray. Lord, although we cannot literally see or hear you, we do see and hear you. We see you in the lives of your servants and in the beauty of your creation. We hear you in the inner recesses of our souls and in your written word, calling us to accountability, encouraging us to lay hold of that which is good, comforting us when downcast, and strengthen us for our task. There are times, Lord, when your presence is very real, giving us courage, taking away our loneliness, and giving us grace to overcome whatever obstacles confront our lives. May those times increase, and at those times when you seem absent, grant us the faith to believe that you are with us nonetheless, that your existence and presence does not depend on our nervous system. Forgive, we pray, our failures in faith and practice. Wherever we have denied ourselves of the benefits of your guidance and strength, forgive us. And wherever or however we have wounded, abandoned, or failed your fellow human beings, and thus denied them and us of the blessedness of friendship, forgive us. As a civic club, we are concerned about the quality of all of life, including our government. Today, Lord, in the midst of a heated political campaign, we seek your divine guidance and wisdom, as well as the courage to transcend party loyalties, that we shall choose those leaders whose causes and passions best represent your will for human life. We pray also, Father, for those in our number who have special needs. We pray for Rich and his family, and we pray for Reed for his successful recovery, and any other needs, Lord, that were unspoken. Thank you for all your blessings, Lord, spiritual and physical. Thank you for this time together and for what being together produces for the common good. In faith and hope, we pray this prayer. Amen.
Thank you, Paul. John, you're going to lead us in our pledge and four-way test?
Glad to, and I'll ask Tiffany to join me in the pledge since she's joining us today. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. If you join me in the four-way test, is it the truth? Is it fair to all concerned? Will it build goodwill and better friendships? And will it be beneficial to all concerned? Thank you, Tiffany.
Thank you, John. For announcements, I think we had a very good event on Saturday and Monday with the pantry project for the Haywood County Schools. Ed LaFontaine, are you on here? I don't see. Ed and Judy came Monday to help sort through the food, along with Ken and Suzanne Howell and Larry Leatherwood and myself. When we got there, we had the good news that somebody else had already unloaded the buses, which was fantastic considering it took us 2.5 hours to sort what had been unloaded. So if we'd had to unload it and sort it, we'd probably still be there. But it was a fantastic amount of food, toiletries, and that kind of thing for the school pantry. And I want to thank all of you guys who helped on Saturday to collect our bus full. And after the thing was over at 2, I was hanging around the bus waiting for the bus driver to come pick it up. And people kept bringing me things. And let's see, who brought some out? Larry Leatherwood brought some. His wife was in shopping when we shut down, and she didn't have anywhere to take it, so he brought her stuff out. I even had one homeless man hand me a bag with some snacks and things in it that he wanted to make a contribution. It was a good event. Wells has an announcement about an upcoming foundation program. Wells?
President Steve had asked that Bob Herman and myself represent the Rotary Foundation for this year as his presidency. And I received a notice the other day that November is Rotary International Foundation Month. And there is going to be a district-wide program that District Governor Rick Shaw wants to do on a district Zoom meeting. And they're going to be having Ann Matthews, who is the Rotary International Vice President, secured for that meeting. And they have asked that if possible, that this meeting is going to be on Thursday, November 12th at noontime. And they've asked that we consider moving our meeting to that date so that we could get this program on the foundation on that particular day. And I talked with Steve about that earlier this morning, and I think he was going to maybe run it by the board to see if that's something we wish to do. And so I just offer that as a shot over the bow as your first notice that potentially that might be coming up. So that's all that I have on that.
Thank you, Wells. Any other announcements? How many folks were at the open door yesterday?
We had four. Dean Montmahan, Tiffany Watts, and Bill Owen, and myself, Larry Leatherwood.
Good deal.
And Steve, Tiffany actually made a video to go along with that. And if you all right with you, I'll see if I can get it to run to share with folks.
All right.
Sorry, Tiffany. Back to you, Steve.
There are no more announcements. Let's do happy dollars. Who has some happy dollars today?
I have one.
Really?
My first happy dollars. So this is for Karen Denny. She's not with us today because today is her birthday and she's taking a very well-deserved day off. So I will do $10 for Karen Denny's birthday.
Very good. Anyone else? I can't see everybody. Let's see.
No one's raising their hand at you at the moment.
All right. Well, thank you, Shelley. And we'll thank Karen for having her birthday. I noticed that Paul Starnes is having a birthday tomorrow. It's good to see all of you who partied last week with Mary Ann back with us. I know you all had a good time. No more announcements, no more happy dollars. I'll turn it over to John.
Steve,
Yes.
Mary Ann wants to say something.
Oh, I'm sorry.
I just wanted to say thank you. I was very honored and I appreciate all the happy dollars you gave me. I had a wonderful birthday and I appreciate everybody's friendship. I enjoy Rotary. I love it.
Very good. I think we all love you too, Mary Ann.
Mm-hmm.
Thank you.
John, turn it over to you to introduce our program.
Thank you, Steve. Well, along the endeavor to bring young leadership before the Waynesville Rotary Club, not only to speak to us, but for us to obviously look at and invite into our organization if they're so willing. I'm really excited to have Dr. Zeke Watts with us today. I actually met Zeke and Joe, Dr. Joe, his partner of Family Circle Chiropractic, at a young professionals social event I hosted behind the gallery. And ever since, I thought they would be great potential leaders, but not until reading their bios did I realize how successful these gentlemen are, both in their current practice, but in their life's work of being leaders. And I'm excited to tell you a little bit about Zeke. Joe couldn't join us today. They're playing tag team, I guess, which is understandable. But Zeke actually is the one that grew up in, no doubt, is the reason why Joe's with us in Waynesville. He grew up in the Asheville area. He was homeschooled. And when you hear how well he's done, if you think homeschooling doesn't work, then I don't know what you heard, but it wasn't for me. Since he was about 10, Zeke, is what you said on your website, that you knew you wanted to be a chiropractor through an experience with some neck issues, and you found it so rewarding, you felt like giving back and helping other people with similar problems would be a great career path. It was interesting to read Joe's bio, and he had that same situation, but with a mother that got great relief from a chiropractic care, and that's what drove him to pick this career. He graduated with honors from Asheville High School, went on to UNC Asheville, graduated in 2013, magna cum laude. Not too bad, I guess. The Bachelor of Science and Special Departmental Distinction in Health and Wellness Promotion. And I also see you minored in drama, so we'll get back to that. He graduated with a Doctor of Chiropractic degree from Waynesville College in Buffalo, New York. I believe that was magna cum laude again. So, yep, that homeschooling doesn't work. He also was one of two department awards for outstanding academic achievement and professional leadership from the college. And it just so happens the other award was awarded to his partner, Joe. So no doubt a great partnership. You indicate you enjoy being, of course, the chiropractor you are, cooking, reading, teaching, playing games, and spending time with your wife, Vivian, and your two cats. His partner, as I've said, is equally as credentialed, and I'm excited that we have both these young fellows in our community as leaders, giving back to the community, not only in their profession, but in many other ways. Oh, by the way, they've only been set up for a couple years, but they won the 2020 Best Chiropractic Award in our area by the readers in our area. So not too shabby. Zeke, take it from there, and welcome to Waynesville Rotary Club.
This is the first Rotary Club meeting that I've done, especially over Zoom. And it's still a little bit surreal to be called a young leader. I'm still feeling like I'm kind of growing into that role, but yeah, so I also have to update that piece on the blog there. I also have a 15-month-old baby daughter right now, so I got to add her onto the list in addition to the wife and the cats. But all the rest of that is pretty true. Yeah, I don't know what exactly y'all want me to talk about today, whether it's just, our business or why we came to Waynesville or the whole thing. So
all of the above.
All right. So Joe and I, as John said, we both wanted to be chiropractors since we were young. And we're both looking for a job that was going to be fulfilling and help people. And we both settled on healthcare, and we both kind of came to chiropractic for different reasons. We've kind of started up, and we're a little bit different than most other chiropractors are. Our training was a little bit different. Dewville College up in Buffalo, New York is kind of a unique school. I don't know if anybody's actually been to Buffalo. It's beautiful in August, but the rest of the year it's a little rough. The weather's, yeah, it's cold. But there's a very good quality school there. And the cool thing about it is that it's a multidisciplinary school. So all other chiropractic colleges teach chiropractic and nothing else. Our school taught chiropractic, physical therapy, occupational therapy. They taught nurses, nurse practitioners, the whole 9 yards. So we were trained in kind of an inclusive multidisciplinary setting where we got to kind of steal a lot of the techniques and treatment things from a lot of different disciplines. We also got some advanced education, trained in a neurosurgery clinic and a level 1 trauma care hospital. So to put that in perspective, most chiropractors, when they get out of school, they kind of struggle to get their requisite numbers in order to practice. So before you can be a chiropractor, you have to have a certain number of adjustments and exams and additional physical therapy modalities and things that you apply in order to meet your minimum competency numbers and actually graduate on time. And most of the larger schools, because they have large classes coming out of there, they, a lot of the interns kind of struggle to get those numbers on time just because there aren't enough patients to go around. Our school had the opposite problem. We had 11 people in my class that actually made it through. So we started with about 30. It's a pretty small school, but 11 of us, including Joe and myself, made it through. And we had 4 different clinics that we were staffing. So it means we got to see a whole lot more people and work with many people who had some more severe things going on. So for example, my first patient, 9 a.m. Monday morning, when I first started out, was a 19-year-old guy who'd been shot 13 times by a machine gun in a gang shooting and was paralyzed on the left side of his body. So we ended up getting him walking again in about 3 months, which I can't take full credit for. He was a champion with some home exercises, but yeah, that was kind of day 1 trial by fire. So yeah, so for those of you who are unfamiliar with what chiropractic is, we're kind of structural doctors, a little bit different from a medical doctor, although the amount of schooling is comparable. It's structured a little bit differently. But where medical doctors specialize in internal medicine, prescription drugs, and surgery, we specialize more in muscle, joint, nerve function. So if somebody has sciatica, plantar fasciitis, mechanical low back pain, carpal tunnel syndrome, headaches, numbness and tingling in their hands, neuropathy, anything like that in the feet, whatever it is, any kind of structural, musculoskeletal, or neurologic issue going on. So we focus really hard on trying to figure out exactly what's going on structurally with each person who comes in, and try to give them as much kind of complete and specific care as possible. Like I said, we operate business-wise a little bit different than a lot of other chiropractors do. Part of that is our business model is very different. So the standard chiropractic business model is as often as possible. We call it the high volume model. Basically, you're trying to get people to come in for as many visits as you can, for as long as you can. And Joe and I don't really like that model. It's very, very effective for making money for the doctors. It's not necessarily very effective for getting their patients better, which is kind of the point of being a doctor, as we see it. So our goal is to get people better in as few visits as possible, and teach them different stretches, exercises, different skills and things that they can take forward into their lives to keep them better for as long as possible. That way they don't have to come back and see us. Our hope from a business standpoint, is that although it makes us less money when people don't come back as often, if they send us their friends, then we get to work with them instead and our business thrives. So there's no shortage of people out there who have pain, and about 80% of all pain is musculoskeletal in origin. So that's kind of where we go from that. But yeah, a little bit of personal history. As John mentioned, I grew up in Asheville and Mars Hill, so I went up to Buffalo, up into the frigid north, for chiropractic school. There's not a chiropractic school in North Carolina, so I figured if I had to move out of state anyway, I might as well go to a good quality school. Unfortunately, that was up in Buffalo, New York. So I went up there, and I got to say the chicken wings are fantastic, but there's a lot of other things that leave some things to be desired. So I was very, very excited to come back down, and I was very excited to bring Joe with me. So we met in chiropractic school. Like I said, we got pretty close because there were only 11 of us who made it through the whole program in our year. So we got pretty close with everybody there. But Joe and I, in addition to being in class for 10 to 12 hours a day and working, we were also the only two chiropractic student representatives on the department council. And we were also the graduate assistants in the chiropractic department. So we were doing probably 16-hour days pretty consistently. And for pretty much all 16 hours of that, we were in very close confines working with each other. So we figured if we could do that and not get angry at each other, we could probably run a business. So, and we're pretty proud of the doctors that we've grown into. We've obviously still got a lot of growing to do. That's why they call it practice. And we try to stick with that as far as we go. But I can think of nobody I'd rather be in business with than Joe. Not only is he an excellent physician, but he's also a stand-up guy with a lot of honesty and integrity, and just a really clear and present human being. So, yeah, so that's where we started. I came back after chiropractic school. I drug Joe down here along with his wife Ellen, who's actually a dietitian who works over at the WIC. She's one of the WIC coordinators at the county office off Exit 104. She was trained at the same school as us, but I drug them back down here to open the business with me. And originally we were planning on opening up in Asheville because that's where I grew up. And I came home and realized that while I was away, Asheville kind of filled up with loud, angry people. So I was looking around trying to figure out where we could open that was going to give kind of the same kind of close-knit small town feel that I grew up with. And well, my mom is from Asheville. My dad is a native of Morganton and was living out in Mars Hill at the time. So I grew up kind of half urban with my mom and half rural with my dad. And I really liked the small town kind of feel. And after living in a larger city like Buffalo, not a huge fan. So we were very, very happy to find Waynesville, and my family's slowly kind of migrating west of Asheville. So most of them are in Canton right now. So I figured I'd beat the rush and just head all the way over to Waynesville. And we've been very, very fortunate. Luckily, we got involved with the Chamber of Commerce. And I see a lot of people on here that I know well from the Chamber of Commerce. And we were very, very lucky to get in with that group early. And that's been a huge benefit to us as a business and just kind of getting to know the community. And we were the 2019, in our first full year of practice, we were the Chamber of Commerce Young Professionals of the Year, which was also a big surprise and a big honor, and we really, really appreciate that. So yeah, that's really helped getting us set up here. We also had a little bit of a windfall. One of our colleagues, Dr. Warren, who's practiced down just north of town for 30 years or so, chose to retire just, I guess it was last May in 2019. And he picked us out of all the chiropractors in town, even though we're kind of the new kids on the block, to kind of, he gave us all of his files and encouraged his patients to come see us, which again was a huge compliment. One of the biggest compliments we can get is when people take the people that they care about and they send them our way, because that means that we've done a good enough job with their care that they trust us to take care of the people they care about most. And that's about the biggest compliment you can get as a physician. So that was a huge boost to our business, as well as a big honor and a big surprise for us. So we've been fairly successful here, and we're very grateful for that. We're not sure how much of that is due to our quality of care. We like to think that it is, but we've also just been really, really fortunate, and we've had a really wonderful support system from the community since we opened up and became involved here. So we're really, really honored and happy to be here. I think that covers most of the bases. I know I talk fast. Did anybody have any questions or anything that you were wondering about? Chiropractically, personally, anything else?
I have a question.
I see Paul raising his hand.
Yeah. Well, really two questions. One, I want to know where your location is here in town.
I'm not getting audio though. Is anybody else able to hear him?
Yes, I can hear.
We can hear
Can
you.
you hear me? Can you hear me?
We can hear you, Paul. I think Zeke's not hearing you. Zeke,
Okay.
can you hear me?
Oh, now I can hear you, Paul. Yep.
Okay. One is the location of your office.
Sure.
Two, we're more familiar, of course, with Palmer
Mhm.
and with Life Chiropractic in Marietta,
Sure.
Georgia,
Two of the bigger ones. Yeah.
which do not have, as you indicated, a multi. Anyway, it's pretty much just for chiropractic. It's
Yep.
not for other things. And I wondered, I'm really interested in the fact that you were able to look with other disciplines, it sounds like, and
Mhm.
maybe develop dialogue across, which I think is very important in medicine, that chiropractic and medical fields that, because when I'm 80 years old, and
Sure.
when I grew up, my uncle was probably one of the first chiropractics in Greenwood, South Carolina, and back at that time, it was not looked at as openly as, of course, it is today.
Yeah.
Being a very important service. But I know we don't have Niagara Falls here, but we do have a beautiful area, as you know, and I hope Joe is enjoying it. But could you answer the other two questions about location and about how the interdisciplinary maybe did a very good job as opposed to the single chiropractic training?
Sure. So location-wise, we're just on the north side of downtown. If you guys know where the Print House is, just down the hill from the courthouse, we're in the same building as them, just left side of the parking lot next to Reach. We're very happy to have Jeff Coleman as our landlord. He's a great guy and has given us a really good deal on the first lease, helping us start out and be effective as a new business financially. As far as the multidisciplinary piece, there's a couple pieces of that. So one of the things that allows us to be effective as doctors is, and do some things that a lot of other chiropractors don't really do. The reason why I describe ourselves as a little bit different is because we do a lot of soft tissue work and we do a lot of exercise and active rehab. Most of that we picked up from our friends and colleagues who are, and our classmates who are doctors of physical therapy. So we were trained a little bit more inclusively, and we get a lot more of the exercise rehab piece of that. So there, for any kind of structural musculoskeletal issue, there's a muscular side and a skeletal side. And the standard chiropractic piece is very, very effective at addressing the joint aspect of that. And to a certain extent, with repeated pieces influencing that part of the system, the muscular side will kind of fall in line. But if you can address both of them effectively, it allows you to get people better in fewer visits, which is more effective care. So the way that we look at it is that the faster we can get people better and the fewer times they need to come see us, the better doctors we're being. So it allows us, because we got a little bit more diverse training, we have a couple more tools in our toolkit that allow us to do things a little bit differently. And we can kind of incorporate that in. Now we're not physical therapists. We're not as good as they are at most of the exercise rehab things, but we are a little bit more trained and a little bit more proficient and a little bit more practiced at a lot of that stuff than a lot of other types of chiropractors. And you mentioned some of the larger schools there, Paul, Palmer and Life Chiropractic being two of the biggest. And I know a lot of good doctors that have come from both of them around in the area. I was pretty involved in the Asheville area previously, and since then I've come across a lot of people through my professional education and going out and doing continuing education events and things. And they produce a lot of really good chiropractors. But we're just what we do is just a little bit different. Our goal and our dream moving forward is to actually grow our practice into a multidisciplinary clinic. So our first step there is going to be adding massage, which we're going to do as the pandemic calms down a little bit. My eldest brother is actually a massage therapist. One of the best that I know. So when he can come join us, he's got a couple family members that he lives just down the road from, technically on the same farm right now, that he would have to kind of quarantine himself away, because our job, we do spend a lot of time in closed confines with people. I'm in a closed windowless room. It's kind of just by nature, and we're kind of hands-on by definition as chiropractors or massage therapists. So his job is a little bit higher risk, and he would have to quarantine away from my other parts of the family, and it would make things difficult for him at home. So we're hoping that once things calm down a little bit, then he'll be able to come join us there. And we're also looking into potentially expanding and getting a larger building with more space over the course of the next few years to where we can grow in. Ideally, we'd like to have primary care, so potentially a nurse practitioner or a medical doctor in with us who can do that piece. Or we'd also like to have a doctor of physical therapy, potentially somebody doing nutritional counseling, kind of branch out. And our dream is to be able to provide all of those kind of disparate medical services together in an integrated fashion under one roof. That way, when somebody comes in, instead of having to kind of bounce around from one kind of doctor to another and then trying to get all of them on the same page and potentially duplicating different exams and tests and everything and incurring more cost to each individual patient and making that more of a burden for each person, we'd be able to do that with everybody together in the room at one time, and each different type of doctor or healthcare practitioner can do their piece that they're most expert at. That way the patient's getting the best possible care with the least hassle and expense. So we're hoping we'll be able to do that in future. The logistics of that they're occasionally a little bit challenging as a new business starting up, but we're actively working toward that goal. So yeah.
Zeke, tell me how you went through the process of choosing the school that you chose and how you found out that it was different from other schools.
Sure. So I looked at most of the chiropractic schools in the U.S. Actually, I'm a little bit of a computer geek. So I made a pretty detailed spreadsheet and called around and tried to figure out all those different things. And I was looking for a very evidence-based school. I also wanted something with small class sizes and excellent clinical opportunities, and something that was reasonably priced. I discovered that most chiropractic schools are priced about the same, and none of them are cheap. So I kind of had to throw that one out the window. So, but I wanted like I said, a small class size. That was important to me because you can get a lot more hands-on experience. And I wanted to make sure that if I was going to do medical school and become a doctor, I wanted to be a good one. And in order to do that, I needed a lot of hands-on, one-on-one ability to ask questions and get a lot of really specific information. So eventually I narrowed it down to Palmer and Northwestern Chiropractic. So like I said, there's a lot of different schools. A lot of them have somewhat different philosophies. So a little bit of history of our professions to give you some context. Back in 1895, our profession was started by a gentleman named Daniel David Palmer, who was he was a magnetic healer originally. From Canada, and he was in Davenport, Iowa, and he founded Palmer College of Chiropractic. His theory was that the bones of the spine would become out of place, and they would, put some pressure on different nerves, and that was interfering with the body's vital healing force, and that would be the root cause of different diseases. So he started moving people's bones with his hands in what he called an adjustment. And they, lo and behold, started getting better. So we've since, over the course of the next 200 years or so, that the theory that he had behind that is not exactly how that works. There are different other kinds of biomechanical constructs and neurologic responses that cause those same benefits, but it is very effective for treating a lot of different musculoskeletal issues. From that, though, so he was very kind of philosophically based. Didn't incorporate a whole lot of science or rigorous academic pursuits of what he was doing and why it worked. There were a few medical doctors who were intrigued by the results that he was getting and came and studied under him and became chiropractors. And then they kind of created an offshoot of our profession that was a little bit more based on standard medical science. And the two have kind of run side by side ever since. So certain schools are more philosophically based, other ones are more evidence-based. Using rigorous scientific testing and everything to kind of double check and make sure that each condition that we're looking at and the different treatments that we use for it are effective and not just a placebo effect that kind of masks that, if that makes sense. So we try to go a little bit more toward the evidence-based scientific side of that. There are some chiropractic practices that are out there that we know they work, but we don't know how they work or how well they work. The science has not yet been able to substantiate those things. So Joe and I, we just personally, we made the decision to not use anything that we can't substantiate with science. We've got plenty of techniques and things that allow us to be very effective doctors that are very well vetted. So there's other stuff out there that we choose not to do because one, it wasn't really included in our training, so we're less than expert with it. So we let other people who are better at it do that piece. And two, we don't feel good about charging people for anything that we can't conclusively say is effective. So yeah, that's that.
Rick Cross.
Yeah, I was just curious, because of your philosophy about seeing patients fewer times and getting them well in that regard, what is the patient experience? Are you giving them more homework like stretches, exercises, teaching them to do some of their own adjustments, manipulations, or how does the patient experience with your practice differ from the traditional chiropractic experience where you go back for an adjustment every week and, you know, till you run out of money or whatever?
Yeah.
Sorry.
Sure. No, yeah, that's sadly, that's more accurate than I'd like to admit. But yeah, so first off, it starts with spending more time with people and really listening to what people have going on and doing a really thorough new patient exam. So there's a set of about 50 or 60 common musculoskeletal issues that most people tend to come in with. If you get really good at treating those 50 or 60 things, then you can seem like a much better doctor than you actually are. There are a lot of other things outside of that that are much less common, but even among those common conditions, everybody has kind of a unique presentation and everybody responds differently to the care. So there's a lot of nuance to what we do, and if you kind of do the same cookie cutter adjustment on everybody, you're going to miss a lot. It's not one of those things you can ever go on autopilot with. So the first piece of that is, like I said, taking as much time as you can to spend with people on that first visit to really get an in-depth understanding of what's going on with all of their different complaints. And more importantly, or perhaps equally importantly, is to really explain what's going on for that person. That way they have a really good understanding of what's going on with their body and how to get it better and what each phase and piece of that healing progression looks like, and what to expect moving forward. Then we go through and we try to tailor, like I said, there's lots of different styles of chiropractic. We try to tailor what we do to what's going to be most clinically effective and what each person's comfortable with. Please don't YouTube our profession. There's a lot of videos out there, people who do some kind of crazy, unsafe things, and a lot of people think it's representative of what we do. Most people think of chiropractic adjustments as the popping, cracking kind of chiropractic. It's called diversified technique, which is, it's a common thing that we do, and when done properly, it can be very safe for most people. But there's a lot of other things that are a lot less aggressive, don't involve popping, cracking, that kind of thing. So we try to tailor that piece for them. And then we really try to go through and give them different exercise progressions at each stage. So we've got a couple different common protocols that we use that we kind of pick and choose different exercises off of based on what's going to be most effective for that person. And we try to walk the line of giving the patient everything they need to keep themselves well and to get better as fast as possible. Most of that doesn't involve home manipulation. There's not a whole lot of manipulations that are really safe and effective for people to do unless they have kind of the advanced training under that. So most of it is exercise rehab. We try to find the exercises. Personally, I personally hate exercising, so I've worked really, really hard to try to find what are the most effective and least cumbersome exercises that we can give people that are tailored specifically to their condition to get them the most results as fast as possible. And there's usually a few stages of that as that whole rehab process happens. So we make sure that we go through and demo all of those things and have our patients do those in the office. That way they understand how it feels when they're doing it properly. And we can go through and correct their form and make sure that everything's working well. And then we send them home with detailed exercise sheets that have pictures and step-by-step instructions and how often to do them and so on and so forth that they can carry forward. And then we make sure to keep up to date with that and make sure if people have different questions, we can address those on future visits. Yeah, most of it is just finding that extra time. We also do a series of different soft tissue techniques that try to help with that. So like I said, there's a lot that you can do with the muscles, the ligaments, the tendons around, in addition to just working with the joints like a standard chiropractic adjustment does. So we have a couple different techniques. A lot of them are manual techniques that we just use with our hands. We also do instrument-assisted soft tissue mobilization, which is not a fun technique, but it's effective. Most of my patients know it as the scraper tool of doom. There's a little blunt steel scraper tool that we use to go through and actually scrape out different bits of scar tissue and things from previous injuries, or if somebody have tendonitis or carpal tunnel syndrome or any kind of peripheral nerve entrapment. We've got options with that, and Joe and I also just got certified to do static dry needling, which is a pain-free version of the dry needling technique that uses needles that are similar to acupuncture needles, which is a very, very effective and very low pain alternative to some of those more aggressive techniques. So again, we kind of mix and match and try to do that as much as possible. So, but yeah, most of it comes down to just trying to make the care as specific as possible and complete as possible, and educating people about why they're feeling the things they are, how to fix it, and how those home exercises and things interface into that. Because we discovered very early, if you give somebody a set of exercises and you say, do these exercises, trust me, I'm a doctor, they're going to do those exercises usually for about 3 days. And unless they get some significant and immediate benefit from that, they're usually going to stop. But if you explain to somebody why they have that piece going on, and how biomechanically that's related to the exercises that we're doing and what we're looking for long term, and they really have a good grasp of that, they're much more likely to stick to with their home care longer. They're going to get a lot more benefit out of it, and then they don't need to come back and see us as often because they're able to manage the conditions at home.
Thank you.
Yeah, absolutely.
George Thompson.
A couple of questions. One is Waynesville, probably the average age is a bit higher than in Buffalo.
Sure.
Are you working with Medicare patients, and are they covered through Medicare?
Yep, go ahead.
And the second question is, what are the most likely referrals that you do for surgeons?
Sure. Like most likely conditions that we would send out for?
Yeah.
So, sure. So let's start with the insurance piece. We do get a lot of people who have Medicare who are over the age of 65. We are technically out of network with every insurance company, and there's a pretty good reason for that. So when we started off and first opened here, we were very gung-ho about trying to get in network with different insurances. That way we could accept everybody's benefits, so on and so forth. And Medicare was actually one of the big reasons why we chose not to do that. And currently we don't take insurance. So Medicare is kind of a special case for chiropractors. Back in the day, they covered a lot of stuff and they had very few regulations. And there were some chiropractors, not all of us, but some of us took advantage of that. And they billed for a lot of stuff that they didn't really need to be doing, and Medicare paid it. And Medicare was tired of that, and they decided to crack down on our profession in around the mid-'80s or so. So because of that, chiropractors are one of the only kinds of doctors who are not legally allowed to opt out of Medicare, which means we still have to send the claims, even if we're out of network with them. They call it a non-participating provider. The other piece of that is there's not a lot that Medicare actually covers. So they'll say that they cover chiropractic care, but in reality, the only service they actually cover is the spinal adjustment, which is at the end of the day a pretty small piece of what we do. They don't cover any of the required exams. They don't recover any of the soft tissue work that we do. They don't cover exercises. They don't cover any work outside of the spine. And all of the rest of that is honestly the bulk of what we do. I mean, the spinal adjustment it's a regular piece of that, but it's far from the whole thing. So what we discovered is, well, the way that doctors and insurance work from our perspective is a little bit different than most patients get to see. So if I can draw back the curtain here for a minute. When doctors get in network with insurance companies and agree to accept that insurance, we agree to accept a smaller rate, a contracted rate, they call it an allowable fee for each individual service, that is lower than what we charge for most cases as a cash price. And we're actively incentivized to make our cash prices for people without insurance for that service higher than the insurance company. The reason for that is if it's lower than what the insurance company would pay, the insurance company pays us the cash rate instead, which means we effectively lose money that we could be making on the same work. Now, the catch-22 with that is we're not allowed to charge different people different things for the same service based on their insurance status. They call it a dual fee schedule, and it's pretty illegal. So basically, if for, say, the spinal adjustment, if Medicare reimburses, say, $40 for that, so I set my fees at $50, and different insurance companies are a little bit different. Each one has a slightly different number for that. So you kind of have to ballpark and just go right above there to get the maximum amount of money you can for the work that you're doing, which is already reduced from what we'd normally charge most of the time. If we do that, then the problem with that is if somebody comes in without insurance, or if they have a non-covered service, which is, like I said, most of those other regular things with Medicare, we then have to charge that patient legally our full cash rate for that, which is higher than it really necessarily needs to be in a lot of cases, because we're trying to match and kind of play that game with all those different insurance companies. So it ends up increasing the amount of expense for people who are paying out of pocket. So when we were doing that, the problem that we were having is that our people with Medicare would come in and expect to get their insurance to pay their piece of that. And then the rest of the things that we have to do to get them better would end up being actually significantly more cost. The other part of that is when we're working with insurance companies, there's a lot of additional administrative burden for us. So we would have to lower the fees that we charge for most things. We would get paid significantly later. Sometimes it's months down the road, which interrupts our cash flow, makes it hard as a new business, particularly starting out. And we'd have to hire additional billing staff. And a lot of the time they just straight up don't pay us. Even when they're supposed to, when we do everything right. They're kind of notoriously bad for that. So it would be a lot more expensive for us to do all of that, and we make a lot less money. And actually, for many of our patients, after we calculated it out, for the vast majority of people, it would actually increase their cost of care. So the way that Joe and I have kind of compromised there to keep our care accessible is that we just do a flat rate. And the way that we do that is we charge for the spinal adjustment, we charge for the new patient exam, and we charge for dry needling, because that therapy actually costs us some to do because we got to buy the supplies and everything for it. Everything else that we do, we've decided just to not charge for. So the way that allows us to do that is we have a lower flat rate that's comparable to what most people would pay out of pocket with their insurance anyway. We do $85 for the first visit and $45 every visit thereafter, which is around what you're going to pay for Medicare with a deductible anyway. The benefit for that for us is that it allows us to give those low rates to everybody across the board. Our fees never have any hidden things in them, so everything's upfront and everybody always knows exactly what they're going to get. And it means that we can bank on getting that amount of money on time, which as a small business helps us stay afloat. So yeah, and we're actually cheaper than most people's insurance anyway, if they have private insurance. So yeah, we do still send those claims to Medicare in hopes that they will properly reimburse the patient for a part of that covered service. Honestly, we're having a little bit of trouble with them. Like I said, they're notoriously hard to work with, and not a whole lot of people are getting reimbursed properly so far. But you know, the way that I try to explain it to people is, even if you have Medicare and your deductible is met, you're still going to be paying about $10 a visit. And if you're going to go see another kind of chiropractor or somebody else who's going to, for that calendar year, they're going to charge you $10 a visit plus all those additional services. You're still going to be paying around about what the same amount would be, and you're going to have less chance of getting reimbursed, and you're probably going to have to go for more visits if it takes them more visits to get the same results. So we try really hard to make our, I know it gets really complicated, and that was a lot of information. Thanks for sticking with me, everybody. But we try really hard to make our fees as low as possible, and keep everything rolling here, keep the lights on. one of the advantages of being able to work with Joe is that we were able to start up our business model, like I said, not with the aim of making a bunch of money. So we try really hard not to take advantage of our patients financially, and we try really hard just to get people better, and the money kind of comes as a side effect. The downside of that is Joe and I don't make nearly as much money as most other kind of chiropractors do, but we'd rather be poor and happy and sleep well at night. So, and we enjoy the job, so that works. Yeah, I'm sorry. After all of that, I forgot the second question there. Can you?
About out of time, but basically, what is the most, in terms of doing referrals, what are some of the issues of pain that you just automatically refer to a surgeon instead of dealing with?
Sure. So luckily for Joe and I, there's not a whole lot that we really have to refer to a surgeon kind of off the cuff. Like I said, we were trained in a neurosurgery clinic, so we've got a lot of experience working pre and post surgery with people with pretty severe issues. And a lot of the time we can make those, we can get those benefits, and actually a lot of the time faster than surgery can, if you count in the rehab time and the cost of that, and significantly cheaper for many, many issues. Even a lot of things like arthritis. Everybody thinks that arthritis causes pain. It doesn't actually. It's kind of a fine distinction, but arthritis changes the way that those joints function, which puts more stresses on the muscles and the tendons around there, and it's actually the soft tissues around there that cause the pain. The key piece of that is you can fix arthritis pain by retraining those soft tissues, even without necessarily getting a joint replacement. So I see a lot of people who come in and they have been told they need a joint replacement, hip replacement, knee replacement, anything like that. And while that would work because it also kind of destroys all those soft tissues and they're no longer generating pain, a lot of the time we can get them better in just a couple visits with a couple different exercises, and they can get full function out of that arthritic joint with no pain. So there are a couple more severe cases. So very, very advanced spinal stenosis, where you get bony overgrowth. It's actually compressing the spine. That's one of those things. With most stages of that, we can still make pretty good benefit for that, although it is a slowly responding condition, comparatively speaking. But most of the time when we say, kind of hands off, we're going to refer you out, is when somebody has gross spinal instability. So, for example, if they have significant ligament ruptures in their spine, at that point, that's a surgical thing. If the spine is actually moving in ways that it's not supposed to, and it's got the possibility of cutting the spinal cord in two, that's an emergency thing. I always tell people, if you have kind of ongoing aches and pains and things, come see me first. If you need surgery, I'll be happy to tell you, but chances are I can get you better faster with less expense. Or if I'm not the right person to treat you, I'm happy to refer out. If you get in a car accident and you shatter your spine, please don't come see me. At that point, you need an orthopedic surgeon or a neurosurgeon. So for those kind of severe emergency cases, surgery is a good option. But the best evidence medical research out there supports using a combination of chiropractic and physical therapy, potentially several courses of each before going into surgery for most musculoskeletal issues. Just because, again, better long-term results in most cases with significantly less expense, and it works better in most cases for most kind of standard run-of-the-mill things. And there's a lot of things that people don't necessarily think of as chiropractic problems, like bunions or a hammer toe or trigger finger or anything like that. People think of us generally as just back doctors, and some chiropractors do specialize in the spine and they don't do a whole lot else. Joe and I are kind of a full service establishment, so yeah. And consultations are free. So if you know anybody and they just want to come talk and they're not sure about chiropractic, we get that. Consultations are free. You can just swing by, set up a time, and sit down and talk with us about what you got going on for 20 minutes and see if it's a good fit. So, yeah. Cool.
Any other questions? Zeke, we've enjoyed having you today.
It's been a pleasure.
We've learned a lot about chiropractic. I worked in an HMO in Tallahassee, Florida, and we had a very strict regimen of utilization for our chiropractors. And I went to them for the first time and got relief and didn't have to go back. So
that's great. That's the dream.
That's the kind of practice I like to explore.
Yep, absolutely.
Ladies and gentlemen, is there anything else for Rotary today?
Just like to thank Zeke as well for coming today, and I'll be in touch, Zeke. We truly would love to have you join us, the Waynesville Rotary Club, if it's a fit for you and Joe or whomever.
Sure.
And,
Yeah, send me
I'll
some more
reach
details
out
on it.
to
I'll be
you and
happy to look at it.
We'll chat about that.
I look forward to it.
Thank you for coming.
It's good to see everybody.
Great
Also,
program.
shout out to Paula. I don't know if she's still online, but for helping us out with I'm sure you guys know, she does the Mountaineer, which the I'm sorry, I can't talk.
Young professionals.
Yeah, the Best Chiropractor in Haywood award was really cool. We didn't know that contest was happening until they sent us an email that we had won it, which was great. So just, thanks to them for running that. It's a great asset for small businesses and gives us something we kind of get to brag about. So yeah, thanks everybody. You see y'all. Have a good day.
See you
Take
next
care.
week.